doing today? Is there anything that I should be concerned about today?
Yes, my child has been acting very weird lately. Like, he's been doing weird movements. He's been acting weird.
Can you explain it into detail?
Like, he's been very hyper. He's been like coughing. His eyelids been twitching. He's been twitching every time he hears a loud noise. Like, he jumps a lot.
So I'm gonna run some tests to see what's going on with the child.
Stay still.
So the doctor will be here in a few minutes.
Thank you, Mom.
Okay, ma'am. So, after some tests, some blood work, having a discussion with my fellow doctor, we've come to the conclusion that your child has Tourette syndrome.
Oh my God.
Yes, there's a 50% chance that one or maybe even both of his parents may carry that trait or the disease.
What?
Yes. It's pretty much a nervous system disorder that involves repetitive movements or unwanted sounds, such as jumping, kicking, hopping, and spinning. Tourette's disease is a nerve-based disorder seen as repeating, accidental. Unfortunately, sometimes your child may make some abnormal movement and twitches and tics that you may find abnormal, which, from what I hear, you've already noticed and observed in your child. Yeah. So the patterns for this Tourette disease is unclear, unfortunately. Although the features of this condition can group together in families, many factors are likely to be involved. Among family members, again, one or maybe both parents can have those traits of the disease. It is very hard to describe a possible future incident, unfortunately, or who else may be even at risk of developing these conditions, as studies are still developing for this Tourette syndrome.
So, it's not me the one with the syndrome, it's the father.
Okay. We can happily have him come in. We'll be happy to take him in and run some tests. There are many steps you can take to help your child. Number one would be deep breathing, meditation, yoga, rhythmic exercise, and other activity to reduce symptoms of stress.
So, what medication is my child going to be taking?
Well, we have a few more exams to run through.
Like, what am I going to do with him? Like, is he going to be normal one day? Is he going to be in school? Is he going to be able to interact with other kids?
And you're asking very important questions, and I'm glad that you're asking those questions. It tells me that you're, very much interested in knowing how we can change this or maybe even alter the situation. What I'm going to do is I'm going to refer you to a medication called antipsychotics.
So what does that mean, and what are the side effects to my
It's
child?
a major tranquilizer. It helps. Yes,
okay.
It helps to relax the body until you can start the treatment with a specialist that specializes in this type of behavior in Tourette syndrome. This antipsychotic medicine is a tranquilizer that essentially sort of just keep your child calm and not have them in areas and places that are too noisy and too rowdy. Has to be very relaxed, less noise, and it'll keep him calm.
Okay.
We can try, for example, cognitive behavioral therapy. Talk therapy focuses on modifying negative thoughts, behaviors, and emotional responses associated with the psychological distress that your child may incur. Exposure and responses to prevention. A talk therapy based on exposing fear or dramatic experiences within a safe setting in order to help reduce any associated psychological distress. So we want to keep be oblivious of our surroundings. Okay?
Okay.
So we'll definitely make that appointment for next week, and I will be giving you that referral.
Okay, thank you.
You're welcome.
Come on.